At 6:30 a.m. in the morning, Dr. Sarah Patel was already thinking about three things: the patients waiting in her clinic, the staff meeting scheduled before lunch, and the claim denial report sitting in her inbox. By the time her first patient arrived, she had already spent 30 minutes dealing with a problem that had nothing to do with medicine: a missing documentation detail, a payer requirement, a claim that should have been paid but was delayed. Dr. Patel did not become a physician to fight billing systems. She became a physician to help people. But like thousands of independent physicians across the country, she found herself spending more time managing the complexity around healthcare instead of focusing on healthcare itself. The frustrating part: her clinic was busy, her patients trusted her, her team was dedicated. The problem was not the quality of care. The problem was the invisible system surrounding that care. Dr. Patel's story is not unusual. It represents a reality faced by many physician-owned practices today. And it raises an uncomfortable question. How did we create a healthcare system where doctors can perform life-changing medicine, but still struggle to understand the financial engine supporting their own practice? I became a physician because I wanted to solve clinical problems. I wanted to help patients. I wanted to improve outcomes. But over time, I saw another problem affecting physicians everywhere. The issue was not a lack of commitment. It was not a lack of intelligence. It was a system built around outdated assumptions. A system where information often arrives too late. A system where problems are discovered after revenue is already lost. A system where physicians are expected to make decisions without having the visibility they need. That realization became one of the reasons I founded OnNext, an artificial intelligence-powered medical billing platform focused on helping small and medium-sized physician-owned clinics reduce administrative complexity and regain control of their revenue cycle. But a larger lesson is much bigger than one company. Healthcare has a hidden contradiction. We have some of the most advanced clinical technology in history. We can analyze complex diseases. We can perform extraordinary procedures. We can use artificial intelligence to support diagnosis and research. Yet, many physician practices are still managing critical business operations with fragmented systems and delayed information. That should concern all of us, because the future of healthcare is not only about what happens inside the exam room, it is also about what happens before and after the patient encounter.